It is commonly believed that mental illness is a chemical problem in the brain. That if something feels wrong, it's because something is biologically broken, and medication is the solution. But that doesn't hold up. Diagnoses keep expanding. More people are medicated than ever, and yet distress isn't going down. If anything, it's getting worse. So either we're facing an explosion of brain disorders, or we've misunderstood what's actually happening. And if this isn't just about chemistry, what is psychiatry really treating? Drugs and Addiction, an Anarchist Perspective, Dickie Dredd. This is part 46 in the video series, in chapter 6 now of Medicine and Misdiagnosis. Section 48, Psychiatry's Empire, from Asylum to Algorithm. Psychiatry was born from the same impulse that built prisons and schools, to separate, observe and correct. The first asylums were not hospitals but holding pens for the inconvenient, places where distress could be hidden from moral gaze of the city. What began as charity soon hardened into control. By the mid-19th century, diagnosis had become destiny. Once labelled insane, a person could be confined indefinitely for failing to conform. The cure was obedience. Thorazine and its chemical descendants replaced the iron bars. When chlorpromazine arrived in the 1950s, it was hailed as liberation, the drug that emptied the asylums. In practice, it merely moved the walls inside the body. The chemical straitjacket, as it was called, allowed patients to sit still enough for institutions to shrink while pharmaceutical empires grew. The same culture that once moralised madness now medicalised it. By the 1980s, the story of disorder had been rewritten as chemistry, a shortage of serotonin, a surplus of dopamine, a broken circuit patched by pills. The myth of chemical imbalance was marketing, not medicine. Selective serotonin reuptake inhibitors, SSRIs as they're called, that's your, what's the classic one? I can't think of the name, sorry. Completed the conversion of mood into market. But they promised happiness in capsules, and Prozac, that's the name I was thinking of, sorry. They promised happiness in capsules and offered corporations a renewable revenue stream. Despite some doctors openly stating that everyone should take them, regardless of mental health, and even folk wearing smiley badges with "I'm on Prozac," and I knew someone who did that, the evidence was ambiguous. Trials were buried, side effects minimised, suicides ignored, and withdrawal relabelled as relapse. Yet the story endured because it served every hierarchy involved: the doctor's authority, the state stability, and the shareholders' dividend. Psychiatry became an industry of reassurance. For every diagnosis, a product. For every product, an alibi. As technology advanced, the asylum digitised itself. What once required walls and nurses now runs on algorithms and apps. Surveillance migrated from corridor to smartphone. Wearable devices track sleep, mood and movement in real time, turning private feeling into data points for insurers and employers. The new patient volunteers for observation, mistaking monitoring for care. Foucault's panopticon has been upgraded with consent and Bluetooth. Control no longer needs coercion, it arrives disguised as convenience. Diagnostic inflation provided the raw material for this empire. Each edition of the Diagnostic and Statistical Manual expanded the territory of pathology. Attention deficit, social anxiety, premenstrual dysphoric disorder, mild cognitive impairment, names that capture discomfort and sell solutions. Ordinary sadness became clinical depression. The boredom of industrial life became ADHD. The language of illness spread until no part of experience remained untouched. Moncrief argues that psychiatry mistook metaphors for molecules, a social crisis translated into chemistry. Behind the rhetoric of compassion lies an economic truth. Distress is profitable. The same pharmaceutical firms that fund awareness campaigns also underwrite the communities that define disease. Whittaker shows how the number of people on psychiatric medication in the US rose from a few million in the 1950s to more than 50 million today. Not because illness multiplied, but because categories did. In the UK, the pattern mirrors it. Prescriptions for antidepressants doubled between 2008 and 2020, even as reported well-being stagnated. The more we medicate, the more symptoms appear. The result is a culture that confuses sedation with healing. To feel less is equated with being well. The asylum's logic survives in miniature. Tranquility as virtue, agitation as threat. Only the architecture has changed. The cell becomes chemical, the supervision internal. The voice that once ordered, "Calm down," now whispers through dosage instructions and app notifications. Freedom is repackaged as compliance. Yet cracks show. The psychedelic renaissance, see the earlier section on that, exposes psychiatry's limit by reopening the question of meaning. Studies at Imperial College and Johns Hopkins suggest that healing may depend on confrontation, not suppression, that awe, grief and release can achieve what years of medication cannot. Such findings unsettle an industry built on maintenance. No wonder regulation stalls. Every hierarchy defends its mythology. Whittaker called psychiatry's ascent an empire built on good intentions and bad science. Moncrief calls it a story of coercion disguised as care. Both reach the same conclusion, that the medicalisation of misery replaced dialogue with diagnosis. The task is not to abolish psychiatry, but to free it, to return understanding where obedience has ruled. Until then, the empire will persist, shifting form with each new device, each new pill, each algorithmic priest interpreting the data of the damned. Psychiatry didn't just respond to distress, it redefined it as disorder, which means what we call treatment may actually be a system for managing behaviour, not understanding suffering. And if that's true, then every diagnosis carries more than meaning. It carries power. So if we've been taught to see our own emotions as symptoms, whose interest does that actually serve? And if the system is expanding, not shrinking, what happens when no part of the human experience is left outside it? Next up in the same chapter, Chapter 6, Medicine Misdiagnosis, is Section 49, Addiction as a Disease, the Convenient Narrative. And think back here to my dad saying all the time, "Mother's ill."